of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey, good evening, everyone. Wow. Talking with Dr. Donna is a little late tonight, but we're on, and we had some technical difficulties. So thank you for hanging in there with us, and thank you for keeping your appointment. You have an appointment every Thursday at 6:30 p.m. So thank you so much for keeping your appointment. This is October. We're still talking about Breast Cancer Awareness Month tonight. We're going to do some facts and some stats about breast cancer, just some really quick details so that you are making sure that you're taking care of your body. Remember, as a reminder, our mission here on Talking with Dr. Donna is to build a generational health network so that we can end the cycle of premature death in the Black community here in America and across the diaspora. And as a reminder, our 4 pillars of generational health are our spiritual pillar, emotional mental health pillar, our physical pillar, and our environmental pillar. Because I firmly believe if we pay attention to these 4 pillars of health, we are going to end the cycle of premature death. All right. So, like I said, October is Breast Cancer Awareness Month. And this is the month where we're really talking about breast cancer, where we're talking about the statistics around breast cancer. And there are so many different types of cancer out there that impact women and men alike. And breast cancer gets a whole lot of hoopla, gets a lot of attention. And that is because it is the number one killer of women in cancer deaths in breast cancer. So 1 out of every 8 women will have breast cancer in their lives. I want you to really think about what that means. 1 out of every 8 women will have breast cancer in their lives. That's pretty scary to think about it. When I think about my own family, I have to give homage to my mom, who passed away from breast cancer. She was diagnosed at the age of 77 years old. She found her lump by self-breast exam. So we're going to talk about why that is so important, that you do your own monthly self-breast exams, because that's how she found her lump. So I always, during October Breast Cancer Awareness Month, have to give homage to my mother, Donna Mae Scott White. Thank you, Mom, for giving me the foundation to be what I am today. I would not have done it without you. I also want to give homage to my Aunt Darlene, my mom's sister, who was the first member of our family to pass away from breast cancer. She died at the age of 39, really young, because back in the 80s, really wasn't a lot of talk about screening, about mammograms, about how to make sure that you remain healthy. And so by the time she discovered her breast cancer, it was too late to do anything about it, and she's passed away. And then I also want to give homage to my Aunt Leona, who is still with us. And she's 83 years old. She is a 2-time breast cancer survivor. 2-time breast cancer survivor. So you might be thinking to yourself, Dr. Donna, you have quite a bit of breast cancer in your family. Does that mean that you have a genetic issue with breast cancer in your family? And the answer, as far as we know, is no, because there is a difference between having genetic markers for breast cancer, which means that there's a gene that is turned on or turned off in your family that causes you to have breast cancer. And then there is what we call familial breast cancer, right? Which is that you actually may not have a genetic predisposition, but there may be other things that increase your risk for developing breast cancer. As we know, things like obesity, uh, things like hereditary lifestyle, things like what we eat, all of these are increased risk factors. And if you are, imagine in a family, in an environment, you guys probably all eat very similarly. Your body habitus is very similar. And so there are risk factors that we definitely have in our family. And I can't say, talk about breast cancer without also acknowledging my cousin, Teresa, who's going through her own breast cancer journey right now. And she's killing the game. You're doing great, T. So this is why Breast Cancer Awareness Month is so important. And this is why generational health is important, so that you can understand what's in your family, what it is that you need to be aware of for your particular lifestyle and for your risk factors that increases your risk of having different types of disease. So we talked about breast cancer being impacting every 1 in every 8 women. And we always talk about cancer, and sometimes people are so confused as to what exactly is cancer. So I saw this video and I thought it was awesome because it's a short video. It describes cancer in a way that I think is so easy to understand. And so I wanted to show that video to you tonight. And I'm hopeful that as you watch this video, you'll get a better understanding of exactly what cancer is. And we're going to come back and we're going to talk a little bit about your risk factors. So let's watch this video.
Healthy cells are the basic building blocks of all tissue and organs in the body. But when cell DNA, the cell's wiring, is damaged, mutated cells begin to rapidly reproduce without following the pre-wired plan. Aggressive cell growth can form a tumor or mass of tissue that, like each individual cell, does not function as originally intended. These abnormal cells, or group of cells, can progress into the disease known as cancer. Breast cancer usually begins either where the milk is being produced, the lobules, or in the milk ducts. Lobular carcinoma in situ, LCIS, is a precancerous condition that forms and is contained in the lobules. Invasive lobular carcinoma is a type of cancer that develops and breaks through the lobules, with the potential to spread to other areas of the body. Ductal carcinoma in situ, DCIS, is a type of cancer that forms in the milk ducts and is considered non-invasive because it has not spread to any surrounding tissue. If the cancer has spread beyond the milk ducts, it is known as ductal carcinoma. Less frequently, breast cancer can originate in the stromal tissue, the fatty and fibrous connective tissue of the breast. Treating breast cancer as soon as it's discovered is very important. If left untreated, the cancer cells may invade healthy breast tissue or lymph nodes. Once in the lymph system, cancer can spread more easily to other parts of the body.
All right. So I hope that you understood everything that was in that video. I thought it was a great video to kind of talk about what cancer is. And more importantly, in breast cancer, there's so many different phrases and terms that we use about what breast cancer is, the location of the breast cancer, that I thought it was a great depiction of what it is that and where the breast cancer starts, why it's called in situ, why it's maybe called, when we talk about something that's metastatic, that means it's gotten out of the confinement of the breast tissue and it is now moving into the out of the lymphatic system into the blood system, and it's spreading to other organs. So as we mentioned, 1 in 8 women will have breast cancer. And as the video also talked about, we talked about screening. It's so important that as women that you get screened. So the best screening method that we have now is mammograms, right? They're uncomfortable, they hurt, they're just no fun, that's odd, but you know what? It's the best thing that we have right now in order to help us diagnose breast cancer. It's the first best thing we have is what I talked about when I talked about my mom's discovery, which is doing your own self-breast exam. When we talk about doing our own self-breast exam, let me tell you why it's important. So let's look at the incidence of breast cancer. So the incidence of breast cancer is how many people are diagnosed with that disease, okay? And so if you look at the incidence, I have my little handy dandy pointer. If you look at the incidence rates, now this is up to 2018. So that's when the data that we have is up to 2018. And when we look at the incidence, that means who's getting diagnosed with breast cancer. We see that the highest bar is for white women. You probably cannot see these small phrases down here, so let me tell you who they are. The highest incidence, people who have breast cancer diagnosed most often are white women, followed by Black women, followed by American Indian and Alaskan Natives, followed by Asian Pacific Islanders, and then finally followed by the Latinx community. Okay, so highest numbers of breast cancer diagnoses, white women. Now, when we look at that incidence, that means that we also want to think about our screenings, right? So mammograms, self-breast exams. It is more common for you to find breast cancer than it is for your breast cancer to be found by mammogram. And I really want you to let that sink in because I want you to understand the power that you have to be able to help yourself. The monthly breast exams is so important part of your monthly routine for making sure that you're healthy. And you want to do that monthly self-breast exam pretty much around the same time every month. If you're still a woman who has your menstrual cycles, you want to do it about 2 weeks before your menstrual cycle or about 2 weeks after. And the reason why you want to give that break is because your breasts go through cycles, they go through changes, and they're tender when you're on your menstrual cycle. And so you may not press as hard because your breasts are tender. Your breasts are, because of the hormones, are having sort of cystic changes. So there's lumps and bumps that you might find there that do not mean that it's cancer. But of course, if you feel it, it might freak you out and scare you unnecessarily. So try to choose a time in the month where it does not coincide with your cycle if you're still menstruating. If you're postmenopausal and no longer menstruating, then I recommend that you find a time for a day that just really makes sense to you. The first of the month, the 12th of the month. My birthday is on the 12th. And so I usually try to think about it around the 12th of the month because, it's my birthday. So that's what I want you to do. I want you to think about it time because consistency is the key. If you do it every single month, you're going to know your breast and you're going to know immediately when something doesn't feel right. And then you're going to go to somebody on your dream team, right? You know who your dream team is. You're going to go to a provider and have it checked out. Okay. All right. So our incidence rates, so are the rates of who's being diagnosed with cancer. This next slide is talking about death rates. Now, this is all Generational Health Network. This is all what we're about here, ending the cycle of premature death in the Black community. Because of all of the people who are dying from breast cancer, number one, this high number here, this big high blue bar, you would expect it to be white women because they're diagnosed more often. So it would make sense that if they're diagnosed more often with the disease, that they probably die more often. But that's not what statistics show. White women are diagnosed more often, but Black women die more often. Followed by white women, followed by American Indian and Alaskan Natives, followed by Latin Americans, followed by Asian Pacific Islanders. So the number of people who are diagnosed with the disease does not correlate with the death rates. And again, it's why it's so important that we take upon ourselves to do these monthly self-breast exams and that we get screening mammograms. In addition to our monthly self-breast exams, every year, you should get a screening mammogram. Now, the recommendations are every 1 to 2 years, starting at age of 40. But you want to talk about your risk factors for disease. You want to talk about if there's a significant family history, and those are going to impact whether or not you're getting a mammogram every 1 year or every 2 years, okay? But you're going to have to discuss that individually with your dream team member to see when it is and how often you should get a mammogram, right? But when we talk about generational health, when we talk about making sure that you have an advocate, when we talk about ending the cycle of premature death, this is it right here. This is in the flesh example of a cycle of premature death in the Black community, and we want to put an end to that. All right, so let's now look at our relative 5-year survival rates, because it's not all bad. We have great treatments now, great therapies now to help you to, once you're diagnosed, to actually get through the treatment. And you can see that no matter the stage that of breast cancer, there's about a 90% 5-year survival rate. That's amazing, because that was not always the case. And so if your breast cancer is localized, which remember that was the in situ from that video, then you have almost a 99% chance on average of having a 5-year survival rate of 99%. That's pretty amazing. That's almost perfect, right? If you have regional, so remember we talked about in situ, which was still in the breast, right? If within the duct, but then you have the cancer that may have spread, but still localized to the breast. That's regional. You have about an 86% 5-year survival rate. But if it metastasizes, if it leaves the breast and moves to other organs of the body, that's when we really start to see very poor prognosis at down to 29% for a 5-year survival rate. So you can see the importance of diagnosing your breast cancer early and getting into treatment really, really early, okay? So we talked tonight about cancer, about what it is, and the various forms of cancer, the incidence rates, the death rates, the survival rates. We talked about screening and why it's important to know your family history. So that's really all I wanted to talk about tonight, because we're going to continue this month of October to bring in and provide you with more information. Tonight, I just wanted to give you that little bit of information to help you to recognize the importance of making sure that you get your screening mammograms, and more importantly, you do your monthly self-breast exams. All right. So, every month on Talking with Dr. Donna, we have the food of the month, and this month is no different. This month, our food of the month is oats. Yay, yummy, yummy, yummy oats, and all the different ways in which you can eat them and enjoy them. We talked last week about perhaps adding oats to the end of your day to help you to go to sleep, because studies have shown that it actually helps to go to sleep. We know there's multiple benefits of oats: lowering your blood pressure, rich in fiber that helps your gut health, keep you regular, right? It helps in your blood flow, and it has anti-inflammatory and antioxidant properties. And so I want to spend a little bit of time talking about what is an antioxidant and why it is important. So antioxidants, anytime you see the word anti, it means it's against, right? And an oxidant, so these things are working against oxidants. And oxidants are some things in your body that create what we call free radicals. And that is things in your bodies that are circulating that cause your body to have an increase in your risk of developing certain types of diseases. So oxygen is great, but when you go through this oxidative process and oxidative stress, that is different than providing oxygen in your body. What that means is that you have your normal cells of your body, they get attacked by these free radicals, and then it takes a normal healthy cell and shrivels it all up into this ugly little cell that has oxidative stress. And we know that when you have oxidative stress, that it increases your risk of developing diseases. Cancer being one of those things that it causes when you have lots of oxidative stress. So an antioxidant, foods that are rich in antioxidants, help when the cells are attacked by these little free radicals. The antioxidant says, no, 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 You're not going to attack my cells. We're going to come in there. We're going to get rid of those free radicals and free that cell back up so that it can function normally. And antioxidants, you've heard it in lots of different ways, but it helps to deal with decreasing your risk of cancer. It helps to slow down the aging process, right? So that you don't look as old as you might be. It also helps to lower cholesterol, decreases your risk of heart disease, and decreases risk of things that are in our environment that are unhealthy for us, like smoke and other pollutants. So the fact that we can have a bowl of oats, or that we can take some oats and sprinkle it into some yogurt, or put it into a smoothie to provide us with these antioxidants is pretty amazing. So for this month, I want you to think about how you can eat oats. And I want to make sure that you share it with us on our channels. Go to my Instagram page, my Facebook page, and share it with us about what you're doing to eat oats to bring in that those antioxidants into your life. All right? All right. Well, thank you so much tonight for keeping your appointment with the doctor. Remember, you have an appointment every Thursday at 6:30 p.m. Tonight, we were a little late, but shout out to the production team, Owen and Elisita. Thanks for getting me back up and getting me on. But keep your appointment every Thursday at 6:30 p.m. talking with Dr. Donna. Oh, thanks, team. Thank you. I'm so honored this year to be the trailblazer for Sinclair Miller Medical Association. I'm receiving the Trailblazer Award for 2022. We have our annual scholarship gala this Saturday. So you can tune in. You can go to my page to look for the link to be able to tune in to see the gala and to support our fundraiser for scholarships for those students who are pre-med and pre-nursing. So thank you, Sinclair Miller Medical Association, for this honor. Thank you, team, for reminding me. All right. Thank you so much for watching Talking with Dr. Donna. I hope you learned something tonight, and that you'll learn it and you'll share it with a friend and pass it along. Remember, our mission is to build generational health to decrease and end the cycle of premature death in the Black community. Thanks so much for watching. I'll see you next week. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna.